Good morning, everyone, and welcome back to Treehouse Humane Society. My name is Shannon, and I am the Senior Coordinator of Volunteer and Community Engagement. And today we are super excited to have you guys joining us down here in the clinic. Today is actually a surgery day in the Treehouse Clinic. So we do surgery here, typically spay and neuter surgeries, but also special surgeries 3 days a week. And so this morning we're going to be walking you through what that process entails. It's kind of a 3-step process, a little bit like an assembly line down here, where we prep the cats, then they actually have their surgery, and then there's some post-op care as well. So I am going to be turning it around. I do want to give a content warning for anyone who has some sensitive stomachs or anything like that. We are going to be showing the cats in surgery, not too terribly close up, but if you're a little squeamish, this is your warning now. And let me turn it around.
Hi!
Alrighty, so I'm trying to yell so you guys can still hear me. That was just the vacuum, but we are joined by Molly Beth and Danny down here. Say hi, guys.
Hi!
And over here is the prep portion of this little dance we're all doing down here in the clinic. So Molly Beth, what is this vacuuming action that you're doing right now?
For prepping the kittens, we have to shave the surgical site. Oh no! We have a very powerful vacuum. We use a vacuum because it's the most effective way to get all of the little fuzzy furs off of the surgery site.
So we've shaved first.
Yes. And then we vacuum up their little furs.
And these are all 3 boy
Yes.
kittens. They are all under anesthesia right now.
Yes.
And so you said one of the things we've done is shaved and then vacuumed up the fur. What's happening over here, Danny?
I am scrubbing the surgical site, so getting all the bacteria and everything off and making the site sterile for the surgery. So we use a chlorhexidine scrub and chlorhexidine solution, and you scrub with each one 3 times. So essentially, you're starting from the middle and you're pushing the bacteria out.
Gotcha. So we've shaved, we've given, we've cleaned the area, and they're also sedated. How long would you say this prep time usually takes for each cat?
From induction, where we give the medicine that makes them sleepy and go to sleep, to shaving and scrubbing, it's about 10 to 15 minutes for each cat.
And what's this kitty's name that you're working on?
This is Peridot.
Peridot. How old is Peridot?
Peridot is about 10 to 12 weeks old. So a little over 2 months to 3 months.
Gotcha. And is this the typical age for a kitten to be spayed or neutered here?
Yes, it is. Typically we say that the kitten should be about 8 weeks or 2 months old, and they have to weigh at least 1.8 pounds.
Gotcha. So for those of us who might be not so familiar with the veterinary world, can you tell us in the simplest terms what it means to neuter these cats?
Basically, the doctor goes in and removes all the reproductive organs. So the ovaries and uterus for the females, for the spay, and the testicles for the boys. And that, of course, makes them not able to reproduce. And that is the goal, because we have too many homeless kitties.
Yeah. Thank you. And Danny, what are you doing over here?
I am putting the masks on them so that when we take them into surgery, you can connect them to the anesthesia or look at the gas.
How many surgeries do we have scheduled for today?
It's It's a lighter day today, yeah. So we have 14 scheduled, but typically we have anywhere between 20 to 30.
So it's a light day in the clinic.
It's a very light day in the clinic.
Gotcha. And all of these cats today, are they our resident kittens or?
So the cats that you're seeing right now are resident kittens. So we have about 9 resident kittens going today that they were in foster then moved here. You can see over here on the floor, we have some of the traps down here. So those are our community cats. I think that they're going to the Cats at Work program. So we'll typically start with the resident cats because we know their status. We know that they're not sick or ill and have had full exams. These guys are ferals down here. So we don't really know their health status.
Gotcha. And after these kitties are spayed and neutered today, they'll be going up for adoption?
That's correct, yeah.
Were you just giving Peridot a little massage there, or what was happening?
I was just checking the heart rate there. So typically we can check the heart rate. We're also looking at color constantly to make sure that they're oxygenating well and that they're doing well under anesthesia. You could probably hear that beeping in the background too. So whoever's working on recovery, William, whoever's working on prep, myself or Molly can hear that beeping going, and that means that the animal who's currently in surgery is breathing well.
Gotcha. So let's follow this little fellow. He's moving from the prep area into our surgery suite. And here we're joined by Dr. Klein.
Hello, welcome to my surgery suite. Got some neuters today.
And just a few spays, right?
Yeah, actually a little light on the girls today, but we don't know what we have with the trap, so who knows? Maybe those are all girls.
Yeah. So right now you're prepping for that neuter?
Well, he's already prepped. He's been prepped by either Danny or Molly Beth.
Gotcha.
And I'm just going to go ahead and proceed with the neutering. It's a really quick and simple procedure that doesn't not involve any suture material. I've already made my incision. I got the first testicle out, and then I use this little instrument to ligate or tie the spermatic cord in the vessels onto itself. Quick little knot. Cut it away. And it's secured. And I do the same on the other side.
So you are pulling out the testicles.
Mm-hmm. And there's a tiny little vessel in there that I want to make sure does not bleed. So I tie it, take that testicle away.
So some questions we're getting are what the monitoring is for this cat right now to make sure they're doing well.
So we have a little device here that measures their heart rate and their oxygen saturation. Right now, the 100 is perfect. It means he's at 100% oxygen saturation. The 179, he's done with the procedure and he handled it just fine. So it's still within the normal range for an average heart rate. Sometimes we see it a little bit lower, but that just lets us know if they're too deep under anesthesia or maybe too light. And we don't want either of those. So, and then this beeping also it beeps every time they take a breath. And if too much time passes without them taking a breath, you'll hear a different alarm. So it ensures that we know that they're breathing adequately as well. I also went ahead and placed a tattoo on him, which is standard for all of our patients.
A tattoo? Is this kitten a rebel, or why are they getting inked up?
No, it's the universal symbol we use to identify an animal as having been spayed or neutered. So they'll never have an explorer to look for ovaries or testicles.
Gotcha.
Mm-hmm. So he's done. I'm going to turn off his gas and he'll be ready to go to prep. And I've got another one waiting for me.
Yeah. Someone just asked, is a neuter more or less complicated than a spay surgery?
I guess that's surgeon preference, or it's different for every doctor. I personally would say that a neuter is simpler. A spay is an intra-abdominal procedure, so you have to go into their abdominal cavity, and with that carries some more risks. So my answer to that would be that a spay is more complicated. That being said, you know, it's possible to have complications from either one, and you do need to learn them both appropriately. I'm gonna actually stand over there.
Yeah. All right, so we're gonna watch this one a little closer up, just a warning to those.
That's a false alarm.
Thank you.
So Dr. Klein is pulling out the testicles and then tying that knot like she said. And Dr. Klein does this fun thing that I find to be quite interesting, where she just slaps those testicles right there on the back of her glove.
They're sticky, and I don't want to fight them when I get them out of the body.
It's also helpful, she mentioned earlier, that way she can clearly see that she's pulled out 2, so she's keeping count.
That's very true. Haven't left a testicle behind yet. All right. I just pull it up. It's done, and we leave it open. We don't suture the scrotum closed. It heals beautifully that way. There's a little availability for drainage with an open incision.
Gotcha. And now you're going to make that tattoo.
Stab it in the green ink. And then I close it with some skin glue. He's done.
And that took you all of about 2 minutes.
Pretty simple. And now, I've got another neuter.
Yeah. And now we say, it's a boy.
Yes, bye boy. And that's how the prep team knows that there's a boy ready and waiting to be taken over. So I change my gloves between surgery, get fresh, clean instruments for each patient.
So we're going to follow this little guy and see what the recovery care is like for him. Danny, if you don't mind just telling us what you're doing.
So I was just taking them off the monitoring equipment, so the thing that was monitoring our oxygen, and taking off the surgical mask. Whenever you carry them, you want to support them by the neck so that they have a good airway to continue breathing.
Well, you kind of want to say, you have such little friends.
This is our recovery area. You can see William's recovering one of the little boys over here. We have our little beach over here. We have one of the guys recovering over here. So it has the tongue out just to make sure that breathing well okay. Everybody will kind of do loops over here occasionally just to make sure everybody's recovering well. So you might hear people say, everybody on the beach is doing well. So they have a sheet that follows them. So I'm working with quartz right now.
Mm-hmm.
So I will take quartz's sheet that's over here to see what services are needed. So at this point, what we're going to do is we'll give the post-op medication, post-op pain medication to make sure that they wake up and they're not painful, as well as they'll get a microchip. Since they're kittens, they don't have a microchip yet. I'll probably assist William with doing a blood draw here soon, since they're under 6 months old. We'll check to make sure they don't have feline leukemia or FIV, as well as get revolution for fleas, ticks, prevention, all that good stuff.
And we like to do all this while they're still under because it's just easier, right?
It's just easier.
Yeah.
If you want to try doing this on a 2-month-old kitten, it's not a lot of fun.
Yeah.
This guy's ready for a blood draw.
You want me to do it or you want to do it? You want me to do it?
Yes.
Okay. All right. So I'm just going to assist William with a blood draw here. So this is for the FELV, FIV testing, snap test. And we have heparinized syringes here so that the blood doesn't clot, so that we can do the testing after we're done with surgery, since there's not time to do it now.
Gotcha.
So William's just holding off the vein for me.
And can you guys give me a holler when you do a spay?
We're about to in 5 minutes.
Great, just let me know.
trapping her now.
It's all right. We're going to give them time to do this blood draw, and I'm going to pester Molly Beth with a couple more questions. Molly Beth, one person asked, do the ferals get tattoos and ear tippings?
Yes, they do.
So all cats who get spayed or neutered will get that tattoo, but only ferals who are being returned to the community have their ear tipped.
Yep, and that's so it's an easy visual sign so that everybody knows that they've already been sterilized.
Mm-hmm.
So they're they're not gonna make any more kittens, and they do not need to be trapped. So they can just go about their lives and be community cats.
Yeah.
So
And this is Amethyst, right?
yep, this is little calico amethyst.
And right now Molly Beth is just giving her the sedation.
Yes, I just intubated her, so that's why she was coughing a little.
Mm-hmm.
She's not aware of that happening, but it's just the gag reflex.
Gotcha.
And I'm giving her a little extra anesthetic gas, so that she's nice and deep when the doctor sees her.
Gotcha. We have someone watching. Christine says, this is so interesting. Thank you for sharing. All right. So back over here to our recovery table where we said Danny was taking care of all of those post-op needs. So a blood draw if needed, a microchip if needed.
I just did the vaccine, so the FDR-CP vaccine to make sure that they're covered for infectious diseases like panleukopenia, calicivirus, all that stuff.
Little ear cleaning action.
We still have Halloweeny over there recovering.
Yeah.
Just checked on him. If he's not up in about 5 minutes, I'll probably reverse the anesthesia.
Gotcha. And so how long does it typically take for these kittens to wake up and come out?
It's so dependent on the cat, but typically they're up and bouncing around within 5 to 10 minutes. If they take over about 20 minutes to recover, we have a medication that we can reverse to get them up. And then usually these guys are back to normal within a couple hours. Sometimes the anesthesia can take up to 24 hours to wear off.
Gotcha. And one thing I forgot to mention was that when they get over here, they're also receiving pain meds right away.
Yeah, that's right.
Yeah.
We practice pretty good pain control here. So in the pre-anesthetic induction, there's a medication called butorphanol. So they have a little bit of pain block there, as well as then we use for post-op, they have another medication as well.
Gotcha. And back down here, this is what they call the beach. So this is where the kittens are right near their eyesight, so they can check on them. They do keep their tongues out. They look kind of silly, but they keep their tongues out so they can make sure that those tongues are nice and pink. They have good oxygen flow. And then once they kind of see them start to stir down here, that's when they'll move back up into the cages. And they are also on heating pads so that they're staying nice and warm. Let's go check back in our surgery suite. While we're waiting for this spay, we're gonna go chat with Dr. Klein.
Okay.
So Dr. Klein, aside from tackling the problem of overpopulation, why else would someone want to have their pet spayed or neutered?
Well, it can also prevent some diseases and some behavioral issues with the females in particular, especially female cats. It can prevent or decrease their risk of getting mammary tumors.
Gotcha.
And in cats, about 85% of mammary tumors are malignant or cancerous. So that's a really important issue right there. Also, it's not uncommon for cats when they're left intact and to have several cycles of several heat cycles and estrogen influence to develop what's called a pyometra, which is an infection of the uterus that requires an emergency surgery to essentially do a spay and remove that infected uterus. And it can be life-threatening if it gets severe enough, and it's also expensive to treat because you're dealing with it under emergency circumstances. So it's one of those things that's just really preventable. Also, with the males and neutering in dogs, it can prevent some prostatic issues and urinary issues, testicular cancer, behavior issues. It prevents roaming, aggression. I don't know if anyone's ever lived with a cat in heat, but that's intolerable. So I would never want to live with an intact female for behavioral reasons.
Yeah. So lots of good reasons.
She's good.
Okay. There's this boy here that's ready.
Okay, I'll grab it.
Alrighty, so Dr. Klein is now going to perform a spay surgery on little Amethyst. And again, I'm going to give a content warning for anyone who's just tuned in. We are going to get a little bit closer to see what's happening during the spay surgery. So if you are sensitive to such imagery, feel free to leave us now.
I have to get my suture everything set up. So.
Yeah. So if little Amethyst was not spayed, how early could she have kittens?
Cats can get pregnant as early as 4 months, which is crazy to think about, but it's true. I've definitely spayed a handful of 6-month pregnant. That's false alarm of 6-month pregnant cats. So I've seen it before, and so yeah, she could definitely have babies in the near future if she were to get spayed today.
Gotcha. One question we got earlier, if you don't mind me asking while you're prepping, is about IV lines. Someone noticed we didn't have any IV lines. Can you tell us a little bit about why we don't have that?
So some cats will get fluids under the skin if we think that they are dehydrated or that they lost a certain volume of fluid during the surgery, especially sometimes the feral cats or any surgery with complications. Our procedures here are typically much faster than the average spay-neuter that's done at a private practice. So given the cost and the time to place an IV catheter, in addition to really the medical need, these animals that we spay-neuter recover so quickly. We have a really well-tailored anesthetic protocol where dehydration just is not an issue with this sort of procedure.
Gotcha.
So for that reason, we don't. If it is a high-risk procedure, then we will. But none of these kittens warrant that today, especially the neuters.
Gotcha. So you just placed a small incision on the cat's abdomen.
Yeah. Place a small incision. Try to keep it small. She doesn't have a lot of fat to deal with, but still going to cut just a small amount away. Now I have my incision made and in the abdomen. This is my spay hook, which I'll use to find my uterus.
Dr. Klein is fishing around for the uterus. Looks like she found it.
And I got it. So this is the uterus. This is the right horn of the uterus. Cats have 2 horns or 2 sides to the uterus. And it connects closer to their cervix. And then on either side is the ovary. So I'll just fish that out right now. And this is, right here is the ovary. This is the ovarian pedicle, or the vessels that feed into that. And this really thin clear band is the ligament that I'm going to cut away so that I can have good access to my ligament and tie that ligament off. or I mean, I'm sorry, tie that vessel off.
Gotcha.
So I just cut the ligament. Then I make a window.
One thing I've noticed is that you're dealing with some pretty small parts here.
Yes, this is a pediatric spay given her age, so we do know that I'm used to it by now, but it takes a while to get used to such tiny structures. Hopefully my eyes don't give out on me anytime soon. So what I did was I pulled on this right side, and then that reveals, with a little traction, it reveals the bifurcation here, which is where the two horns meet. So this is the right horn meeting the left horn, and I'm essentially going to do the exact same thing. I'm pulling it out, so now here's the ovary on the left side. And I just repeat.
It looks like we've got some friends in the veterinary field tuning in, because I've got a question here that you'll probably understand better than I. Kylie says, maybe it's just due to going inward more for the females, but is there a reason for the covering during a spay versus the previous neuter?
Oh, that's a good question. Because we're entering the abdomen, we want to have a completely sterile procedure here. So everything that you're seeing here that's green is sterile. It's been through the autoclave. Originally it's went through laundry, and then it went through an autoclave, which removes any infectious pathogens, and it's clean. And so anything touching the cat here, like my instruments, and stay sterile that way. So a cat neuter, because we're not entering the abdomen, technically, it's not like a 100% sterile procedure, and so it's really just not required.
Gotcha. Thank you for your question, Kylie.
So this is the only time that I'll use suture in the body, and I've got, this is called the uterine body right here, where the two horns meet, and I just place a little, it's called a Miller's knot.
What does that knot do?
It will ligate off my uterus, because there's two vessels running alongside the uterus that I need to make sure will not bleed after we cut the uterus away.
Gotcha.
So all that's needed is that one little suture, and then I just take my scissors, cut it away.
It's all right.
That doesn't always happen, but it's normal if it does. And then I just dab away any extra blood. Really no bleeding with that, so we're good to go. And the spay is done. Now I just have to close my body wall here, and then I close the skin.
And Brian, our teammate upstairs, says you're all rocking it today.
Oh, thank you, Brian. Alrighty, so.
Dr. Klein, if you had to guesstimate, how many spay and neuter surgeries do you think you've done in your career?
Oh man, I wish I knew the actual answer to that.
5 million.
No, I have not done 5 million. It's in the thousands. My previous job before Treehouse, I was doing in the 30s every 5 days a week. 30 SpayNeuters that often. So got a lot under my belt then. I did that for 3 years. Yeah, don't know. Probably the thousands.
Thousands of surgeries. Yeah.
I don't even know how many we've done this year. There's probably a number that exists, but right now I don't have that off the top of my head.
Yeah. It's a lot.
Yeah. And then for the skin, we just do a fairly simple in one side
And we've got these cute little pole stars, guys.
and out the other. So really minimal suture used, especially with a small incision. And that's my knot for the skin suture. It's just a single, it's called a cruciate knot because it's a crisscross shape.
Yep. They're getting oxygen and isoflurane. So since we use the TT decks, and these are non-rebreathers,
How quickly does this incision usually heal?
pretty much only
We say about 10 days to monitor the incision. It's usually pretty well healed within about a week.
Gotcha.
That's kind of like the average.
And that's how it's supposed to look. It's supposed to look like a baby's butt.
And do those sutures dissolve on their own?
They do. So this patient will not need a recheck. It won't come back to have any sutures removed. We will schedule. We will schedule a like just a monitoring of the incision while they're here to make sure that everything is healing normally. I still will give her a tattoo. Takes a little bit of this ink right here. And that way, anybody who comes across this cat in the future knows that she has already been spayed. And I do a little dab of skin glue over my incision, and then a little dab of skin glue over the tattoo. And she's done.
You made it look so easy.
All right, so that was a spay. A kitten spay.
Yeah. And then we say, "We got a girl."
Got a girl.
I think I'm the only one that finds that to be such a charming little phrase we use. Kylie, thank you for asking. Amethyst is a little over 2 months, I believe.
Yeah, she's somewhere between 2 and 3 months of age.
And now Amethyst moves on to recovery. Thank you, Dr. Klein, for that.
You're welcome.
The boys, we don't
And
because
the process just keeps going, as you can see. Sorry for interrupting you guys. So Kitten's just constantly moving from the prep to the surgery suite and out here to recovery.
Thank you.
Alrighty, so I hope that was really informative for you guys. Probably saw something that if you're not in the veterinary field, you've never seen before. So as you can see, our clinic team is a talented crew of professionals down here. Today there were only 14 surgeries, but there are days where they're performing upwards of 30 surgeries. And one thing I did want to cover since you're here is we recognize that spay or neuter surgeries can be pretty costly, especially at a private veterinary clinic. You can contact us at treehouseanimals.org or 773-262-4000 for information on resources for local, more cost-effective spay-neuter surgeries. But we are also very excited to be opening our own veterinary wellness center in April of 2021. And that will be where our community members can bring their cats and their dogs for spay-neuter surgeries as well as wellness services. At an affordable cost, it will be accessible and affordable, and we're super excited about it. So thank you so much for joining us today. Stay tuned for updates and information on the process towards our Veterinary Wellness Center. And if you have any additional questions, maybe about what you saw today, feel free to leave them in the comments and we will follow up with you. Thanks so much for joining us today, and take care.
Just like that.